While health and safety protocols may be pretty straightforward for vaccinated adults, they can still be questions when it comes to kids. The Delta variant, first found in India, spreads faster and is linked to increased hospitalizations. It's causing some concern in families with children under 12 who cannot get their shot. Here to discuss this and more is founder of Gramercy Pediatrics in New York City, Dr. Dyan Hes. I'm actually really glad that we're talking about this because I'm one of those parents, and you know, we were out and about down the shore over the weekend by the casinos, and the casinos have dropped their mask mandate, but I wasn't sure. We were running in to go to the bathroom. I didn't think my daughter should go in without a mask. I looked around, and people were kind of doing whatever they want. Eventually, we said, you know, just wear a mask. It's better than not wearing a mask. We were just going in and out. But I realized that there was like a real gap when it came to information for kids who are probably not going to get vaccinated, at least for a while now, maybe, you know, months, maybe longer than that. Are you concerned about kids becoming the focal point of the Delta variant?
Well, I'm concerned in only the effect that it's scary to parents, right? It's very scary to hear that, listen, their host, the adults, have been immunized. So now where is the virus going to go? It's going to go into the unimmunized, which are children under 12. That being said, there are no increased hospital rates, really, very minimal in children, and no increased deaths. And I still think COVID in children has been blown way out of proportion. I've said this all along. I was just thinking before this segment started, I didn't have to refer one patient that had COVID to the hospital. Patients are now returning to the city. They're like, oh, like when I'm doing the history, like, oh, by the way, we had COVID. Nobody's like, oh my God, Dr. Hes, we had COVID. Like, it's not like that in kids. It's really been a mild illness. And I just feel that there's so many other viruses going around now, like enterovirus and rhinovirus are rampant in New York City right now, which is the common cold. But remember, we have kids who haven't been exposed to anybody for 15 to 18 months. These kids are getting sick, high fevers, staying home from school, missing a few days. I am not really worried. I just think that anything that is related to COVID gets blown out of proportion. I think what you said is a great point. You have to use parental judgment when you go in that casino. If you're not comfortable with your kid being unmasked, mask your child. I just think that that's where it's going to come down to. I honestly don't think the masks are going to make a huge difference in children at this point because the teachers are immunized. And I think if COVID goes through, camp or school now with the Delta variant, I still don't think it's going to be severe. I think the kids are going to have a cold. And I think if you're an adult, it's your responsibility to be vaccinated. I think when the vaccine is approved for children, I do not think we can mandate it because kids have not been getting that sick. They are much sicker with the flu. I'm much more concerned if my patients have a pool with a fence because drowning is the #1 cause of death in children aged 1 to 4. And when I say that, they say, why are you asking about a fence around the pool? And I'm not as concerned about COVID. I really don't think your child's going to die of COVID, but I do think there's a realistic chance that your child could wander into the pool and fall in and drown. It's all perspective.
So where would the most likely outbreak then occur? If there were to be an outbreak, Dr. Hes, where would it happen?
It's going to happen in the Southeast where the vaccination rates are low and the mountain states where the vaccination rates are low in adults. And those adults should be scared because the Delta variant in adults who are obese, overweight, heart disease, diabetes is much more lethal. And we know that 2/3 of Americans are overweight or obese. So that, to me, is much more of the focus, where the focus should be on getting these adults vaccinated so our kids can go back to healthy lives.
And are the symptoms different for the Delta variant versus the other ones?
Not really. They're trying to make it that they are, but it's just a headache, sore throat. I mean, the problem is that all viruses really present the same, and that's why these poor kids have to get a swab shoved up their nose every time they have a runny nose. And what 3-year-old doesn't wear a mask and have a runny nose because it's just humid out and they're licking their mask, and these kids are getting tested nonstop. I just had to test my daughter who's vaccinated and had COVID with a PCR because she's going to camp this week. Like, do I think that PCR is going to be positive? This is a waste of resources. There's so much better. It's just the CDC guidelines are so not in touch with reality of what we're doing in medicine that I feel that as physicians, we have very little faith in these guidelines. I'm trying to help an acting teacher restart her children's acting class in New York City. And you have to think about the square footage. Do we really have to keep kids 6 feet apart? Because that's what the CDC guideline is. But most schools only kept kids 3 feet apart. That could be double the cost of rent for her. The guidelines are very iffy.
So, Doctor, you may have seen a study published in JAMA yesterday, or JAMA, that found that in 2020, children's birthday parties could have fueled the spread of COVID. Tell us about these findings. Are these gatherings, in your opinion, still risky? And what did you make of what they uncovered?
Well, I don't think it's surprising. I think it's just as similar to the Thanksgiving, how we knew that the rates were going to go up after Thanksgiving, how we knew the rates were going to go up after Christmas. Listen, a birthday party entails going to a store to get a present, going to get a cake, dropping your kid off, the parents standing around and schmoozing while your kids are having the party. And that was at the peak of COVID, right? So these studies are retrospective. They're not now when the parents are vaccinated. They were when the parents were unvaccinated. And people were desperate for social interaction. Do I think that we should ban birthday parties? No, I just think that we're going to do tons of retrospective studies and look back and say what mistakes were made and what weren't. But is it the cost of being socially isolated and not having a birthday party and never seeing your friends? I have many more kids who are suffering from depression, isolation, eating disorders, mood disorders, stranger anxiety, much, much more than they're suffering from COVID. And I think that birthday parties are okay.
All right. Dr. Dyan Hes, always great to talk to you. Thank you so much, as always.
Thank you. Have a great week.
You too.